Hello everyone, it is Friday. This is Insta Live on Friday. This is Audrey Button from Safe Harbors of the Finger Lakes. I use the pronoun she, her, hers. And it is the last Friday of September already. So like I said last Friday, is that, next month is October and it is Domestic Violence Awareness Month. So our topics for next month are going to be domestic violence focused topics, and that should be coming out sometime next week. So make sure you check out our social media to see the schedule for the next month, and we'll have that up next week. So excuse me. Before we kind of get started in the topic for today, I just want to go over some basic stuff, so I always like to give a content warning, as some of the material I may be discussing may be sensitive to some, so please take care of yourself however you need to. And I just do a quick disclaimer every time. The views and opinions expressed in this video are not necessarily those of Safe Harbors of the Finger Lakes, but of those in the video. So if you remember the last couple Fridays, I've done some topics around like self-care, and then it's also suicide awareness, suicide prevention month, and it's self-care awareness month. So, and I know 2 Fridays ago we talked about domestic violence and mental health. We're going to talk about sexual violence and mental health. Well, they have similarities because it's interpersonal and sexual violence generally have kind of the same impacts on mental health. I want to kind of just talk about sexual violence a little bit more in depth and how it's related to mental health. Okay, so we'll go ahead and get started. I really want to point out, common, reactions to trauma, and I know we've talked about trauma-informed care and trauma, just in general, the lasting impacts it has on people, people developing PTSD, and what that looks like. So you might see some similarities across the stuff that we've already talked about before. So victims and survivors of rape or sexual assault events are at a large increased risk for developing depression, that PTSD, so that post-traumatic stress disorder, which we talked about before, substance use disorders, and that one's very common because oftentimes people, and I know we've talked about this before, who have struggled with PTSD or, trauma, have dealt with trauma, oftentimes develop unhealthy coping mechanisms to deal with their stress and trauma. So oftentimes people may turn to using drugs or alcohol as a coping mechanism, or they are forced to use drugs or alcohol in an unhealthy relationship. To be aware of, that's why it's also common for people who are victims and survivors of sexual violence to develop substance use disorders. Eating disorders, especially, oftentimes people of sexual violence struggle with their own body, especially something, it almost feels like something was taken away from them. So their own appearance and image, they really struggle with. So oftentimes people develop eating disorders, but also, like I said, they develop those unhealthy coping mechanisms. So over or under eating might also be a coping mechanism for people as well. Okay. Anxiety is another big one that you might see as well. So just thinking along those lines, what does that also look like? So oftentimes these people are victims and survivors of sexual violence are, oftentimes experiencing, they might also just, use self-harm as a way to deal with their trauma. They might develop STIs or STDs, and oftentimes that's because from the rape, or not initially from the rape, or if they had been raped, they might have gotten it from the perpetrator. Or also B, you might see it, they might practice unsafe sex as a way to cope with a lot of their trauma as well. So they might get STIs that way as well. So you might see that. And then we've already talked about substance misuse, and that's another way to deal with stress. Dissociation, oftentimes they don't feel like, and I've talked about they have a hard time, feeling like they own their own body. Dissociation is part of that. Stuff just doesn't seem real to them. It just seems weird. They're out of place. They're almost not in their body kind of, situation. That's a very common response. A lot of times people have panic attacks, eating disorders, which we already talked about, pregnancy. So they might have been pregnant as a result of their rape, or they might be pregnant as a result of unsafe sex or unprotected sex, or multiple partners, could increase the risk of pregnancy. Sleep disorders, oftentimes like insomnia, they have a hard time falling asleep or staying asleep, or they wake up frequently during the night. Oftentimes people who've experienced sexual violence have contemplated suicide because of all these things. They experience frequent nightmares, flashbacks, and they oftentimes isolate themselves. And I mean, we see that in a lot of other, victims of other violence, so like also domestic violence as well, but sexual violence, is also important to recognize that, people experience these things, even if it's like a one-time event, like a rape, versus like a domestic violence, which often happens over long periods of time. A one-time experience can cause as much trauma as something that happens over, and it's really hard to measure trauma. And like I said, everyone experiences trauma differently, and two people experiencing the same event might have two completely different trauma reactions. Wow, I'm having a really hard time talking today. So they might, experience like completely different reactions, and that's dependent on past experiences of trauma, just how they perceived the event, how their body reacted. It's just, there's so many factors into it. So just something to keep in mind. And just to keep in mind really important things that need to be involved in a victim and survivors of, sexual violence recovery, like the aftermath of it. I mean, even beforehand, the education piece, teaching consent, all of that stuff is super, super important. But, especially after, the trauma, what you can do to help them get on that path to healing. So individually, what's going to cause more harm than good is them developing those unhealthy coping mechanisms or responses. So oftentimes there's a lot of self-blame. They have a lot of avoidance behaviors, and they're developing those unhealthy coping mechanisms. So a big thing for like that individual is to teach healthy coping mechanisms, make sure they have self-confidence, being supportive of them, reminding them that they're, here, that they're doing it, that they're, you believe them, everything like that. That's really going to help, for a survivor at that individual level. So if you're looking kind of in their, close circle of people in their life, family and friends, or people who are closest to them, it's really important for them to show a positive post-assault environment, being as supportive as possible, finding on the support that they need, especially if you don't know how to provide that support, and just being there and listening to them, acknowledging them, believing them is really, really important for recovery. Especially because if there is a negative experience with family and friends, especially after the rape or assault, it can be extremely detrimental, because that will also lead to a lot of that isolation piece, them feeling like they're alone, no one believes them, kind of thing, okay? And then, another important level is how are, your legal professionals, service providers, anyone else involved in the, involvement in this sort of thing, handling this? Are they, making sure they have a relatively positive experience? I mean, I know reporting it is not necessarily, the greatest experience, but it can be empowering depending how it's done. That's the whole trauma-informed care piece. To make sure, survivors and victims of sexual violence feel empowered. They can find what they need. Some people might not report, and that's okay, and they're fine with that, and they have other means to heal and cope with that. Some people need to do that. It's all individual based, so it's really important for these service providers to assess based on the individual. Not, it's not a one-size-fits-all kind of thing. So really, really important how these service providers and legal professionals involved with these people are handling it. So just assess each individual, see what they need, try to be as positive of an experience for them as possible. And, just keeping in mind, like I said, prior history of sexual victimization may impact that recovery or response as well, and that's something to also keep in mind. As well. And I really like to point this out, not all survivors of sexual violence will develop health and mental health problems. However, healthcare providers, mental health services, and substance abuse treatment programs will likely encounter patients with physical or mental health problems who have a history of sexual victimization. And there's a lot of crossover between those groups of people. So just something to be aware of, that they're more likely to experience these things if they've dealt with other health issues or present other health issues. Or like, remember, we've talked about ACEs and trauma-informed care. We talked about physical health issues that chronic stress, causes. Maybe they have those issues, so that's something to be aware of. Maybe this was impacted by sexual victimization or domestic violence or a past traumatic event that caused a lot of these health issues that they weren't dealing with, in a healthy way. They developed unhealthy coping mechanisms or whatever it may be. So the big part of this is, helping a survivor of sexual violence in dealing with their mental health especially is to be holistic in the approach, to be individualized and just be trauma informed. Just assume that everyone you've come across in your life or work with has experienced some sort of trauma, and that's the best way to approach it. So I know that wasn't hopefully as detailed as I would like it to be, but it's just something to think about. Like I said, the big thing for especially sexual violence survivors is that they all experience it differently. They have different methods of healing. Some healing may take not that long. Some may take the rest of their life to heal from it. It's really all dependent, but the best thing you can do is make sure they have those positive experiences with your friends and family, service providers, society as a whole, to hopefully, make sure they get on the road to recovery and healing. So with that, we're going to end today. So a big thing, reach out for help if you have questions, comments, concerns. You could always message us on our social media. You can comment on the video. But you could also reach out to us at our 24-hour hotline, which is 800-247-7273. You can always go to our website as well if you just want some more information. That's www.shflny.org. And, just be a good support system for these people who've experienced that. And, I guess that's that. But make sure you tune in next Friday. Check out our topics for next month. Those will be posted next week, and I hope you all have a great weekend. Thank you.